Hello.
Hi, how are you?
Doing well. It worked. Good to see you.
You as well.
Thanks for joining us live.
No problem. I'm so excited to be here. But how do let's see, there's a bunch of words in front of my face. How do I get rid of
There's a bunch of words in front of your face. Let's see. Is it like people's names? Mm, I lost you a little bit. Can anyone hear us? Having trouble with the connection. I might have to redo this. Let's see. All right. Can anyone hear me? Let's see if I can get this. Okay. Okay. Gotcha. Okay. Perfect. All right. So we will go ahead and thank you guys. We'll wait for Dr. Weinstein to join us. Here we go. Is that
there?
better?
I I'm back. We are good.
Okay. Is there still words in front of your face or?
I'm good. We're good.
Okay,
Yeah.
fabulous. All right. So
All
welcome
right.
and thanks everyone who's kind of filtering in. We're just doing this series to really highlight board certified dermatologists and ASDS members as the real skin expert, people who have studied skin care, skin disease, skin treatments in school for many years. So Dr. Weinstein, would you want to just introduce yourself, tell us where you practice, what your training is, a little bit about that?
Yeah, of course. So excited to be here. Thank you so much for inviting me. It's truly an honor. I am at the University of Rochester. I do medical and cosmetic dermatology. I work closely with the residents, so I'm very much involved in teaching and part of the training program. I mentor residents and med students. That's sort of my side gig, and I love it. And prior to this, I was in private practice in Manhattan. And then prior to that, I did a fellowship actually through the ASDS with skincare physicians in Boston. And so that means I spent a whole extra year training in lasers and cosmetics. So just really have a passion for that and I'm happy to provide that here locally.
That's wonderful. Wow, what wonderful training. And just by way of introduction for myself, Hayley Goldbach, also a board certified dermatologist, and I practice at Brown University. Also love working with the med students and residents. They're just fantastic, like Dr. Weinstein said. And I did my dermatology training at UCLA and a Mohs fellowship with some cosmetic dermatology as well at the University of California in Irvine. So today we're talking about scars, which as a Mohs surgeon is a topic certainly near and dear to my heart because I'm in the business of making scars and hopefully more elegant scars than not. But I want you to let me know kind of what you do with scars. Like what are the types of patients that are coming to you with scars? Are they surgical scars, traumatic scars? What kind of scars are you seeing most often in your practice?
Yeah, certainly. And I love this topic, by the way, because I feel like it's under discussed and we see it
Absolutely.
every day in practice. And so it's so nice to be able to share with everyone kind of the breadth of scars that we see as dermatologists,
Yeah.
because a lot of people don't know that that's sort of, a derm thing. I mean, certainly plastics plays a role in other surgical specialties, but in the non-invasive world, we are in the business really of repairing, remodeling, sort of blending scars of all types. So to answer your question, I see a ton of keloids. So I see a lot of darker skin patients. Keloids are very common across the chest, earlobe, keloids, et cetera. And with that comes hypertrophic scars. So I see hypertrophic scars post-surgical. So a lot of like breast surgery, breast reduction, breast augmentation, et cetera. And then sort of in a separate category, we think about more of the atrophic scars. So I see a ton of acne scars.
So
So
atrophic
you have
meaning
our,
kind of indented, right? Not above the surface
oh,
skin.
that's right. Yes. Thank you for clarifying. Yeah. So acne scars, we see a ton of because I'm close to university, it's very common amongst college age, I don't want to say kids, but adults, young adults, to then become
Sure.
more aware of the scarring as they're gaining their independence. So we see a ton of acne scars. And then, as you know, what's close, near and dear to your heart are the surgical scars. So I see those as well. I tend to see post Mohs and surgical scars a little bit later in the game because we do have a Mohs surgeon who we have a few Mohs surgeons who are excellent, but I do address their scars as well.
Absolutely. So maybe we should also define, there's a lot of actually misinformation about what is a keloid. So a lot of times patient will tell me, I tend to get keloid scars, which we take very seriously as a surgeon, because when you have a keloid scar, trauma to the skin, like cutting the skin or damaging the skin, can lead to more keloids. But sometimes I don't think that people quite understand what keloids are. Do you want to explain a little bit about what a keloid is?
Yeah, certainly. So first and foremost, keloids are most likely to develop in certain areas. So, we see them a lot on the chest, on the back, on like the upper shoulders, like I said, on the earlobes or even on the tops of the ears.
Yeah,
We see them less on the face.
which
So
is
it's
which is
important.
lucky for people.
Yes, which is amazing. It's so important to talk to your doctor about, your scars and how you heal. And I think it's our duty as well. I always kind of do like a sneak peek. I'll like look around their body if we're not doing a full skin check to heal from scars. But so keloids have certain locations. And then what they are is irregularly formed scar tissue that goes beyond the barrier of where the initial insult was. So let's say you had an acne bump and it was a small circle, maybe the size of like a pencil eraser. And then as it healed, the scar tissue grew irregularly and beyond the border of the initial scar. And that is by definition a keloid.
Right. And so so keloids, even among dermatologists, there's a lot of not disagreement, but sort of different ideas on how to treat keloids. Some people inject them with steroids, some people use radiation, some people cut them out. What's kind of your keloid cocktail of the moment?
Yeah, certainly. Keloids are tricky. So I'll just start with that. There is no tried and true way to eliminate keloids. Like if I wish I had an eraser for them, but we don't. But
Right.
what we do is first we will see like what stage of healing is that keloid in or in development, right? So I always ask if it's symptomatic. If the keloid is symptomatic, meaning it's causing like itching, tenderness,
Hmm.
pain, like sometimes on the ear, it's hard to sleep on it.
Yeah.
If it's symptomatic, then that tells me that it's like sort of alive, something's going on, it potentially is growing. And that's what I do use a cocktail. I use corticosteroids and 5-fluorouracil.
You mix them
And
together? You mix together the steroids and the
I
factor?
do mix them. Yes, I do.
In a
Because
half and half ratio, or what do you like?
that's correct. I do 1-to-1. And I truly believe that the steroid helps with those inflammatory symptoms. So like the pain, the burning, the growth pains, and then the fluorouracil helps with the cell replication, right? Because it's used in other specialties as a chemotherapeutic medication. And that's a little scary to some patients, but once we go through and explain the process, it makes perfect sense. And I've never had anyone say like, no, don't treat me. So first and foremost, we inject, and we also will use our pulse dye laser,
Mm,
which
okay.
addresses the redness. So yeah, so oftentimes in keloid scars, there's a lot of underlying redness, and that's just because of the increased blood growth, or excuse me, blood vessel growth that goes into wound healing.
Sure.
And so the if we can treat those blood vessels with the pulse dye laser and then inject, that sort of gets us to a place where we can see, how much smoother can we get it, how much flatter, how much can we reduce those symptoms, and if there's any like tension involved, how much more comfortable can we make the patient?
And then how soon, if someone has prone to keloids, if they're having a surgical procedure or some other trauma, how soon do you like to start your injections for keloids?
Oh, right away.
Right away.
So
At
if
suture removal,
they're,
when the stitches come out?
oh yeah, so if they're prone to keloids and there's an injection or surgery in a high risk area, I will at that time kind of massage some of the cortisone onto the keloid. I'll start with corticosteroids in that situation.
Gotcha.
Onto the surgical scar.
Onto the surgical scar. And then you start injecting as soon as you see something problematic.
Yeah, then I'll just monitor. So I'll have those patients come back every month
That's great. That's good
and
advice.
just kind of keep close tabs on them.
And we should say that if anyone watching wants to ask a scar question or another skin question, please feel free. I'll just be watching the chat. So let's talk about non-keloid scars, kind of run-of-the-mill scars. I think there's a lot of misinformation about scars that I hear from my patients. Very well-meaning, but misinformation. What do you think to you? What's the thing that you hear most often about scars that you're like, gosh, I wish everyone knew that this was not true? Like, what's a big scar myth for you?
Oh my gosh. The one that drives me crazy is that the sun will help your wounds heal.
Oh, that's not a good one.
So, oh my gosh. Yeah. So you'll see patients who, not my patients, of course, because we've talked about it, but people who think that if you have a surgery or if you have like a scar on your leg or something, they'll lay out and expose it to the sun
Oh,
because somebody told them that it'll heal better that way.
okay.
And
Myth. Don't do
yeah,
that. That could cause you to have
don't
a
do
light
that.
scar. Okay. Or a dark
Yeah,
scar, depending on your skin tone.
right.
Okay, thank you for busting that myth. That's a good one. We have a couple of questions in the chat I just wanted to address. So we have, I'm going to mispronounce your name, but Christina Najeda, maybe? So how do you feel about silicone Band-Aids? I think this is such a good one because there's not great evidence for a lot of these kind of over-the-counter treatments for scars, and people always want something. But there is actually decent evidence, I think, for silicone either Band-Aids or scar sheets that we call them. You can buy them pretty cheap, drugstore. And I tell at least my surgical patients, as soon as we're done with the stitches out, you can cut it to size and put it on your wound. Some people actually use them a little bit earlier. What are your thoughts about silicone scar sheets for your patients?
I agree 100%. I'm right there with you. So post wound healing, I will tell them, even like post surgery when the stitches come out, I will have them use a silicone Band-Aid, silicone scar gel. I like the ones with SPF in them.
Oh, that's a
They're
good idea.
just
So like a
lovely,
gel that you
right?
apply. Mm-hmm.
Yes, it's a gel. I tell them to put on a thick layer. It almost will sort of dry and form a coating on top of the scar. And if it has SPF in it, that's even better. Or they're covering it, right? So if it's in a sun exposed area, they're covering it with, nonstick gauze or something like that.
That's perfect. Okay, so you usually do that kind of stitch removal. Okay, thank you for that question. Someone wanted to know about burn scars and whether there's a different treatment method. So burn scars, oops, let me just get that away. I'm just gonna have to write something in the comment. Okay. Okay, so burn scars. Do you have any tips for burn scars? What do you do? Let's start with like a small burn. If you're in the kitchen, you're cooking, and you burn yourself, what do you like to instruct people for wound care for minor burns to start with?
Yeah, so typically minor burns heal really well. But if you do get burned, and this is pre-scar, the best advice is to keep it moist. So you want to keep something like Vaseline or Aquaphor on top of it and keep it covered. You don't want it exposed to the elements, to pollution, to, your dog licking your leg or whatnot, which happens, right?
Terrifying, but true, yes.
Yes, yes. So with burn scars, so first keep it covered, keep it moist, let it heal. And
Moist
then
with
depending
ointment, not water, though, right?
with ointment. And just to throw out there, another thing that we tell our patients often, I'm sure you agree, is not to use Neosporin, polysporin, right? It's a burn,
We
it's
do
a
not
burn
like
wound.
Neosporin
It's
as
not infected.
dermatologists.
Yeah. It,
Yep.
I mean, typically it's nothing is infected, right? Doesn't need to be treated with that. Plus, it's one of those like top allergens. And so sometimes patients will
Yeah.
use Neosporin and then come back with a worse rash. And that's the
Yes.
reason why.
Nope.
So
No
just
Neosporin.
Vaseline, no Neosporin. um, Vaseline or Aquaphor.
Okay,
And
so just cover
then
that.
just, yeah, depending on how it looks, you're going to want to keep it covered, protected from the sun, even if you feel like it's
Okay.
healing, because those have a tendency to hyper or hypopigment, of course.
Right.
Um, and if then there's a textural or surface irregularity, we can use a very light laser on
Yeah.
it to help to resurface that area. And I use a non-ablative laser. I have the Halo.
Mm-hmm.
And so it's actually hybrid, so it's a little bit non-ablative and ablative. But I use very light settings and I'll just sort of smooth it over.
Okay, interesting. I had used, I remember I had a patient who had a really bad burn scar, and we did use like the Cyton's erbium, so an ablative laser to kind of try to
Yep.
remodel. But the burn scars can be really tough. So thank you for asking that question. But so it sounds
Yeah.
like in order to prevent it, we want to keep it moist with Vaseline. If you do have irregularities from a burn scar, like it's like the scar is thickened or painful, that's a good time to see a dermatologist. It can be treated with lasers. Sometimes people do inject them as well.
Hmm.
Things like steroids. Okay, and then we had another question: can scars be hormonal? I think that's a good question. Do you want to take that?
Yeah. So I think that the the like overarching answer is yes, but we have to think about what form those scars. When I think about hormonal, I think about acne that
Mm,
develops along the chin and jawline.
yeah,
And typically, what's unique about that acne is that it tends to be more cystic
yeah,
and
deep.
it tends to deep,
Mm,
that's correct, deep and painful.
yeah,
And sometimes you can't even see it. It's sort of like a feel thing. And those are very hard to treat. They tend to come back in the same spot every month. And we talk a lot about hormonal acne and, put patients on appropriate medication if needed. But those types of acne bumps can scar.
yeah.
And so if they're not treated at the beginning, it's really hard to sort of catch up with that.
I
I
feel
have
like.
a little one here
Do we have a little one?
who's
Hi.
yes, saying hello. This is Miss
Welcome to the
Elia.
Instagram. You're a derm mama. I have my little one in bed because she's even littler. So,
Yes,
um,
yes.
so
Thank you for joining.
for acne, I feel like that is another myth we sometimes hear. People say like, I don't want to treat my acne because who cares? Like it's going to go away. It's just cosmetic. And the truth is, acne can actually lead to lifelong scarring if not treated. So I
Yes,
always want to let people know that you're not being vain by wanting to get your acne treated. You might be preventing scars that are even tougher to treat down the road. And then
that's true.
we have Lilu913 who asked when, and also hi to Natasha Mezenkovska. Looks like we have a
Hi,
mutual friend.
Natasha.
um, when treating scars with laser, at what point of healing do you recommend that? This is such a great hot topic in scarring. When do we treat scars with lasers? I'd like to hear your take on this.
Yeah, certainly. So, it's been studied. I just pulled up a paper in JAMA from 2011. This was one of our derm journals, and they looked at scars treated at the time of surgery and then 8 weeks post, I believe. And no, that was wrong. They looked at scars treated 8 weeks post and then at a longer time frame. And the ones
Yes.
treated sooner, right? The ones treated sooner healed better. And so my general philosophy is with surgical scars, the sooner the better. And that's why, I was saying I don't see a lot of surgical post Mohs scars because we have our own Mohs surgeons. But, when I get my hands on a surgical scar, I encourage treatment right away rather than waiting. And then I'll just throw in a quick note to what I just said, in that when scars are red, so a lot of surgical scars just stay pink for a while. They're
Sure.
not necessarily that they look bad or they're hypertrophic or like getting thick.
Right.
It's just that they're pink.
Sure.
And so there's a debate there as well where if you treat sooner, you can eliminate that pink look. I've done a lot of like post thyroid surgery scars.
Hmm.
But if you wait, a year or two, it will resolve
It will.
as
Yeah.
well.
Yeah. That's what I tell
And so
patients. Kind of a
yeah,
balance. You don't want to take someone's money,
right.
and do something that the scar would already look better. But you're right. I think we used to say just let scars remodel, because they remodel all the way up until a year. But the truth is, the literature does show actually the sooner the better. So I'm really glad that you brought that up.
Yeah, absolutely.
Another, and actually there are some papers that have shown that if you actually treat a scar like the day of surgery or suture removal, you can even have good outcomes. I have to say I've not adopted that yet into my practice. I'm still kind of recommending treatment about the 6-week mark,
Yeah,
with, you know, some sort of either fractionated laser, either ablative or non-ablative. Um,
that's right. Yes.
okay. Okay, someone wants to know if a keloid is already flat, which we can talk about. It's probably not a keloid in that case. This is Pato Carranza 90. Can you treat that to match the skin color? So I would probably start off by saying that if it's flat, it's probably not a keloid, unless it's a keloid that's been treated. But say it's a scar that's flat. Can you treat it to match the surrounding skin color? What do you think?
Yeah, so it depends. Are we talking about a lighter scar or a darker scar, right?
Mhm.
So let's start with the lighter scars. If there's a lighter scar that's flat, those are very difficult to treat. But we have an expert in our field, Dr. Jill Weibel, who talks about laser-assisted drug delivery, and she
Yep.
uses a laser to, first go over the scar, and then she'll massage on some Latisse, which
Mhm.
is a topical prostaglandin. Essentially, many people have heard it about, for eyelash growth,
It's also
but
known
she'll
as
massage
metaprost for other people.
bimatoprost.
Mhm.
Thank you. And she has shown that with that technique, that you can help to fill in those light areas. And so that's one technique for lightening scars. There have also been studies that showed using the 1927 thulium device that you can also stimulate some repigmentation in lighter scars. Um, for
Oh, I think you
trick for lighter scars,
for scars that you're trying to get. So I've heard of people either using lasers or microneedling and then applying that Latisse or that bimatoprost. I think that one's probably the toughest, especially for folks who are kind of darker skin and healing with lighter scars. That I would say, I don't know if you agree, that's probably the hardest type of scar to treat, for me at least. If I see someone come in with a scar that's lighter than the surrounding skin, it's very hard to add pigment back, which is something we know from conditions like vitiligo.
yes.
So I think that's really the holy grail. I have not personally tried the thulium, so I think that would be something kind of exciting to try and see if I could have success with that. We
Yeah.
have Dr. Guanche, hello. And then how long should you keep your scar out of the sun for? Ooh, forever? What do you
Yeah.
think, Dr. Weinstein? Is that possible?
Forever. No, I
Forever.
mean, let's talk about where it is, right? So if it's on your thigh and you're going to be at the beach, then just be smart about it. Put on your sunscreen,
Right.
reapply every 2 hours. I say it's okay if you have like a strip of zinc, like a white band-aid on it.
Why not?
It's okay. Like,
Yeah.
right? People know now sunscreen is a hot topic. It's cool to wear white zinc under your eyes. I'm just kidding. But
Very
but
chic.
definitely, yeah, it's super chic. No, definitely keep it covered. And within reason. Just don't lay out and get burned, right?
Let's talk a little bit about skin of color. So people with darker skin tones. So we always, when we are talking with folks we treat all varieties of skin tones in dermatology.
Yes.
When we're dealing with folks with darker skin tones, sometimes we have to talk about scarring that turns darker. Do you want to talk a little bit about that, how you can prevent it and how you treat it if it happens?
Oh yeah, for sure. I treat a lot of darker skin patients. I think it's just the nature of what I do and the location. And so my most common procedure with my darker skin patients, well, I shouldn't say that. One of the most common procedures is actually doing the halo. So
Mm, interesting.
a pretty aggressive laser, and I use it for treating acne scarring.
Wow.
Um,
In darker skin
I
patients too.
in darker skin patients, I go through a whole routine with them. So we start with, optimizing their acne treatment regimen, eliminating their active breakouts, and then dealing with some of the pigmentary abnormalities, which are the hyperpigmentation. We do chemical peels.
So those
And
are
once we get,
dark marks. Sorry to interrupt, but if you get dark marks
no,
in acne, that's hyperpigmentation or too much pigment.
Exactly. And then once we get to a place where we feel like everything's calmed down, and we've sort of evened out as much as we can, I will pre-treat these patients with a lightening agent, a topical lightening agent. We use hydroquinone.
Sure.
I'll pre-treat for 2 weeks prior to the procedure. I will have, do the laser, and then I'll have them post-treat with a potent topical steroid, something like Lidex. I'll have them do it twice a day for 3 days and then restart their hydroquinone once they feel like their skin is, back to normal. So usually that's about a week.
Great. Well, that's wonderful. I feel like there's too many people are a little bit worried in terms of treating darker skin, because when we're using lasers, the concern is always that you're giving energy to the skin. And if you know someone heals with dark marks, it's possible that your laser could actually make it worse, which is why I always tell people, especially if you have a darker skin tone, please see someone who's well trained, because it's not nothing. If you get a Groupon, you get someone, it's their first day, they're not trained. We have seen horrible things, horrible scars from lasers, and horrible kind of like skin color changes from lasers. And I'm sure you've ended up treating some folks like that.
Oh, yes. I mean, great point. It's my worst nightmare is when those patients come in with who've had IPL.
Oh,
That's where I see the
that's a
most
popular
problem.
Groupon.
Yes.
Oh, what could go wrong, right?
Yeah. Yeah. So cheaper is not always better, is in fact probably never better. And a lot of, question marks come up with price. It's always hard to accommodate everybody. Everything has a price tag. And
Yeah.
so we really work our hardest to help make it budget friendly.
Yeah.
We have payment plans. We also work a lot, like I said, with the residents. And so if there's something that somebody just can't afford and it's really affecting them, psychosocially,
Yeah.
emotionally, their day to day, we'll work with them and arrange it at a resident clinic. So that it then becomes a teaching process. One, and they also are getting a treatment that's helping in more
I feel
ways
like
than just,
yeah.
superficially.
And that is such a hot tip. If you are interested in a cosmetic procedure or another dermatologic procedure, and it's something that's absolutely out of your budget, a lot of academic centers, both Dr. Weinstein and I work at academic centers, have resident clinics for the most part. And usually, if you can get involved with one of those, you can get your treatments for either discounted or even free. I know that we run a cosmetic clinic where we offer Botox fillers and lasers to patients for half off the price. So I think that people don't always know that, and they think that they have to go to someone who's not well trained to get a laser or a cosmetic procedure at an affordable price. So I think that's such a good tip.
Yes.
Find a dermatology department at a local institution and ask, hey, do you have a resident clinic? Do you ever have patients in the cosmetic clinic? That's a
Yes.
good one. Okay. And then, Katie Berkovich, thanks for answering these questions. Our pleasure. People can feel free to keep asking questions about scars in the comments. So let's talk a little bit about, I want to go back to acne scarring, because I think probably
Yes.
acne scars are maybe some of the more common scars that we see. Walk me through, when you meet someone with acne scarring, how do you approach the patient?
Yeah, that's how much time do you have?
Seriously, we take a whole hour just on that, right?
Yeah. Gosh, acne scars are complex.
Yeah.
It's not always what meets the eye. So I am known for getting right up in your face. What derms do, they just love to see and feel and figure out what exactly is going on first. So first, what I'm doing when I'm in your face is I'm looking at what types of scars you have. So not all acne scars are created equal. We have boxcar scarring, which tends to be more angulated.
Like little rectangles, right?
Correct. Yes, little rectangles. So I'll just go step by step. So for boxcar, a lot of boxcar scars, we see them a lot on the temples
Yeah.
actually.
Yeah.
I will first recommend a series of subcision treatments. So that's basically where we anesthetize or numb your skin locally. So a tiny little injection, and then I'll use a very sharp needle, but you don't feel it because you're numb. And then I'll go in and break up some of the scar tissue underneath the scar.
Do you use this
And
kind
that
of like a
helps.
barb needle, or do you use a regular like 18 gauge needle?
I actually use a 27
27.
gauge. And I kind of use a fanning technique where I can really feel those fibrous bands and, break them up, do it until it's smooth.
You're actually releasing the scar under the surface of the skin, right, with your needle.
That's correct, yes. And flooding the area with a lidocaine or, kind of blowing it up with lidocaine or saline will help to bring that scar to the surface, the base of the scar to the surface.
Right.
And that's why we do techniques like subcision. Um, so for boxcar scars, we'll do subcision and then I'll laser them right over it the same day.
Same day.
Um,
Okay.
Same day. For ice pick scars, and those are the ones that tend to look kind of like this on the skin. So they look like little pinholes almost.
Yeah.
Um, we do, and they're commonly like right on the cheeks or even on the chin. We do a combination of TCA cross. So this
So that's
is a
chemical peel.
procedure. That's right. We use a chemical peeling agent called trichloroacetic acid, and you literally like drip it into the base of the scar to create a wound to promote wound healing, right? So that you want to lift that tissue um, so that the scar can sort of, have not as deep of a base to it, essentially.
And what
And
percent
then we,
are you using at the base there?
yeah, I use anywhere between 80 and 100.
And then you're putting it on with like a
Yeah.
little cotton tipped applicator, a little Q-tip in the area.
Yeah, so I break my cotton tip applicators and I use the wood
Like dirt.
sharp tip on the wood.
Mm-hmm.
I've also used those little beady needles and I've actually just like very gently dripped it in, which it
I love
works
that.
really nicely. Yeah, I love that technique. It's clean, it's not sharp, it doesn't hurt as much. So, and then
Yeah.
for rolling scars, those are sort of the the ones where when you change the light that you're in, you can see them more dramatically with like side lighting. And so
Mm-hmm.
patients will say, some days they look better, some days they look worse. A lot of people will say, when I'm in my car, it's the worst because they have that rear view mirror light and it's sort of reflecting on the side. Rolling scars are also difficult to treat, but we use our treatment. So my general spiel is that I can help you. It's not going to be overnight.
Right.
It's going to be a process. Let me show you some pictures of patients who we've treated that have had positive outcomes. And I want us to be aligned with our goals so that our expectations are realistic. I'm not going to give you your baby skin back, but
Mm.
it's going to look better. And if you're okay with that, we can proceed, right? And so they get visuals, they get the counseling. It's a long haul.
I think that's great. And I think another point that I would add to that is when I see a patient for scarring, especially for acne, it's really important that you're not still having acne spots. So the first thing we often do is actually see if we can help you get the acne calm down. Because if you're making new scars, you're wasting your money. And also, you could make the scarring worse if you're over treating it during that time period. So I think some people don't realize and they're kind of disappointed if they see someone. We want to make sure that you're not having scars newly forming. And then once that's kind of burned out, then it's when we treat the scars. I don't know if you treat, sooner than that, but I like to make sure everything's kind of calm personally.
Yes, I will. And if there's always those stubborn spots that pop up,
Sure.
and I don't hesitate to put them on doxy or an oral antibiotic, which also
Right.
acts as an anti-inflammatory agent, if we're going to start doing procedures. And usually they're fine with that.
Okay, so I just let's see. Okay, I think we got to the questions. And all right, so we won't keep everyone forever, but I think one thing I get asked a lot is about creams for scars. Are there any miracle creams you have, things you recommend to people to put on scars, either new scars or old scars that you think are really exciting?
The only cream you need for your scars is tretinoin.
That's a dermatologist answer to everything, I think. Right? It's our miracle. That's it. It's a retinol, a retinoid.
Yes, a retinoid. And I'll tell you why. When you have acne, you're probably on a retinoid anyway, right?
Mhm.
To help promote and increase the rate of cell turnover. What it also does is help to stimulate your collagen production, which is irregular and slows significantly as we get older. And so, if you want to help treat the scar and help with that wound healing and remodeling, a retinoid is very important to be on at all times. So, aside from the silicone gels that we talked about earlier with sort of fresh scars, I think just maintaining a regimen with retinoids is essential. Is there anything else that you would lean
You
on?
know, I sometimes with my surgical patients, I do have them do some scar massage with just any like Vaseline or some sort of ointment. And I think that the evidence behind that is sort of mixed, but I
Yes.
think that it can be somewhat helpful as long as it's not too inflammatory. So sometimes I recommend Vaseline, a little bit of scar massage. I like a kind of a hippy dippy Vaseline that I use for my baby. It's pipette. So I have patients sometimes use that. It's a non-petrolatum based Vaseline for people who are anti-petrolatum. I'm trying to think if there's anything else. Unfortunately,
What's it made of then?
the what?
What is it made of? If it's
It's made
non-petrolatum, I'm
of, it's
probably
sort of botanical. So you can't have
okay.
like high, you can't be very allergic to use it. But I think that its main base is sunflower oil. So it's mostly bland with a few other kind of, it's great for kids, just so you know. I'm not sponsored, but I use it on my own skin all the time. Um,
Nice.
So what else? So yeah, I think there's not, people want these kind of miracle scar creams. People always bring up vitamin E. I'm fine with vitamin E if you want to use it. I don't think it's like a miracle cure, but I think it's helpful to have people doing something. And I forgot to
Yes.
ask you how long you recommend people put the silicone gel on and whether you have a preferred brand of that.
Yeah, so the how long answer is it's, you know, I'm a dermatologist who loves to keep a close eye on my patients. And I know that's sort of a gift just in terms of being an academic. So I will sort of guide you through that by whether, whether we share photos or we meet every few months. I think that in general, as you said earlier, that we know that it takes up to a year for scars to reach their healing potential. So, if we're looking at a year, that's probably how long you should keep using the dressing.
That makes sense. Okay, so
Yeah.
I want to end
Oh,
with
and
two
the
final
brand.
questions.
Uh,
Oh, brand, yeah, sorry.
Yes. I like Biocornium because they have an SPF 30. And then there's one, and Biocornium though is hard to get. I think you have to get it through a doctor's office. So one online that we found that we like is called Scar Away Gel,
Okay,
and that you can purchase on Amazon.
that's great. Okay, good tip. Scar away. Um, all right, so I wanted to end with two questions. One is it ever too late to treat a scar? Are there any lost causes?
I don't think so. No. I mean, I will have at it at a scar in whatever stage. Just fully knowing that my relationship with the patient is the most important part of it, and guiding them through each step of the process is what's going to mean the most, in terms of outcomes and how they perceive their attempt at treating the scar. Um, Clearly, just based on our discussion, I think earlier is better. But if you have scars that you've been hiding or you didn't know that there was a treatment for, it is worth asking those questions. So I don't think it's ever too late, especially if it's bothering you.
It's never too late. I love that. Yeah, I totally agree.
Yeah.
I totally agree. People think, or I have patients that say, who cares? I'm old, but you can tell it bothers them. Like, you're never too old
Yeah.
to care about what your skin looks like. You're never too young. We want to make people feel confident and happy and comfortable in the skin that they have. Um,
Right.
okay, we are on Instagram. So we have to ask, what is your skincare routine? What are you using nowadays?
Oh, okay. Um, I'm going to answer that to the fullest, but I'm going to circle back because I saw a question come in that I think is really important.
Oh, yeah, please.
Somebody asked about retinoids, that they're derm plastics that don't use retinoids. So I want to be clear that
Ah,
yeah, so, and I want to just clarify, I want to be clear, when I say use retinoids, it has to do with acne scars and scars that are atrophic, which is that they're depressed. Um, they're if you've been on this whole time, thank you for being with us. And you've probably learned at this point that there are so many types of scars. So
Right.
when we counsel on different creams, we have to be, and this was probably my fault, we have to be very specific on what types of scars we're referring to. You know,
Yes,
silicone-based scars are not appropriate for acne scars, right? So
absolutely.
silicone scars for post-surgical scars. The retinoids would be for acne-based or depressed scars. And then, lightening agents and things we can think about for darker scars. So just make sure that when you see a derm or whomever, yes, your board certified dermatologist about your scar, you know that they're counseling you based on what type of scar you have. The scar is a broad term.
That is so, I missed a couple questions, so I would like to get to those. So, um, LLW twin, lift lip scars, pulse dye laser, and steroid injections. I think it's hard to know without seeing what the lip lift scar looks like. If it's red, I think pulse dye could be appropriate, right? Steroid injections
Yes.
usually for scars that are raised. Do you have anything to add to that?
So since I'm not a plastic surgeon, I don't know where the lip lift scar is. It here?
I'm not sure. I
Where
don't.
is it?
I mean, we do lip lifts with like Botox or,
Yes. Yes.
and I have created scars for skin cancers here, but I think if it's on your cutaneous lip, meaning the white part of the lip, that would be something that would be maybe appropriate. But we should
Yes.
always, we cannot give formal medical advice. So we would encourage you to see a dermatologist. But in general, do you have anything to add to that?
No, I mean, I think, yes, cortisone injections for thick scars, pulse dye laser for red scars, and those can be used together because often red scars and thick scars are one and the same.
Okay, that's
Like we
perfect.
see that as, a
And
type
then
of
do
scar.
you think collagen supplements are beneficial for wound healing? So interesting. I answered this question for a Vogue article, not for wound healing, but for like wrinkles. And I did a bunch of research on it. And
Yes.
my answer is I don't know. There's the evidence is not great, at least for wrinkles. There's like one study that showed that there was a subjective, meaning someone's opinion, that fine lines around the eyes looked a little bit better. But as scientists, we can think that most collagen supplements are just protein, and for the most part, protein they eat is broken down by your stomach acid. So the idea that that protein is then translocating through your gut somewhere along this tract all the way through the other side and finding its way to
Yeah.
the skin is, for me, somewhat hard to believe. But I also don't think it's necessarily harmful as long as it's like a safe supplement. What do you think?
Yeah, I'm so happy to hear you go into that because it's a question we get every day,
Oh,
right? Well, I just started these collagen supplements or collagen cream. And it's really like a huge question mark. And
yeah,
I use that same explanation. I just don't understand how it goes from your stomach to like here,
yeah.
um, right here. And I will say that I was listening to a lecture by one of my nearest and dearest mentors, Sabrina Fabi, who said that she had learned that collagen supplements can be harmful to your kidneys
Oh, interesting. Okay.
in probably in excess, but perhaps there are some variants that have been harmful. So I just would be careful with collagen supplements. I know some derms talk about it and love it. I I stick to the evidence and the science, and I don't have any great evidence to support it.
I'm with you. And we got some
Yeah.
wonderful colleagues chiming in to let us know that lip lift scars will be at the base of the columella. So that's right here.
Thank you.
Forward lift. So yes, I think that the advice still stands for that
Yes,
particular.
thank you.
Um, yeah, that's great. Okay. All right. So it's 8:45. I should first
Okay.
ask, is there anything we missed about scars? Kind of does anyone have any burning questions? And Dr. Weinstein, do you have anything that you wanted to add in terms of scar tips or tricks or myths that you wanted to say?
Gosh, I think we went over so many things. I think that if you missed any and you just joined, definitely replay it because we went through like all the myths, all the tips, all the tricks, all the types. Um, the one thing we didn't mention is laser assisted drug delivery for keloid scars. And so
Oh,
I
for
do that
keloids,
as
yeah.
well. Yeah. So if I remove a keloid scar, I will do a simple shave removal. So that just means I numb your skin and we remove it. And then I will use my ProFrac, so my Erbium YAG, fractionally ablative laser to essentially ablate that tissue and then deliver the medicine topically. So what we're doing is we're increasing the surface area through which that medicine can penetrate and then, really get to the base of the scar. So that's something
And
that
you cut
sort
out
of,
a little bit for me, at least are you actually taking the injectable Kenalog medication and rubbing it on? Or
yes,
what did you say you rub on?
I'm rubbing on my one-to-one combination of 5-FU and cortisone,
Kind of
K40,
want 10,
40.
40. Great.
Yeah.
Wonderful. Okay. Someone asked about silicone products for keloid scars. I think we were saying that silicone products are probably best for like surgical scars. We don't generally recommend silicone products, I think. At least I don't for keloid scars. Do you?
No, I don't.
Okay, because it's just to clarify, the thought behind silicone products, it also helps kind of the tissue hang together. So I always tell people, this is my thing that I always want my surgical patients to know. People always point to sternotomy scars, which are scars that you see like down the center of people's chest. That's kind of your best case scenario for a scar. For a scar from surgery or from trauma, the thing that makes an ugly scar is tension. So skin pulling on skin. That's what makes an ugly scar. There's a couple other things from flaps that are beyond the level of detail needed, but basically it's pulling apart. So anything that helps the skin stay opposed together is going to make a prettier scar. And the other thing I sometimes recommend is Botox for scars. So
Yes.
you don't want your scars to move around. So if you have scars in the face, if I am your surgeon and we're doing a skin cancer and you're very concerned about the scar, I will offer you Botox around the scar. That helps your muscles from pulling on the scar and making it ugly.
Yes, especially those that are right here.
Absolutely,
I
because it
always
wants to
treat,
kind of
yep,
pull apart.
yes,
All right, and
that's
then
right.
someone said silicone for burn scars. See, that I wouldn't recommend silicone for burn scars either for that reason.
No, just lots of moisture
Yeah.
with
Okay.
Aquaphor Vaseline.
All right, so the people want to know. We should share our skincare routines as
Yes.
dermatologists on Instagram. It's a must do.
Okay, drum roll. Um, so first, you can't talk about your skincare routine without talking about what kind of skin you have, right?
So true.
So, so my skin is a little bit oily.
Mhm.
I tend to be a bit acne prone. I develop acne in the hormonal distribution, and I also get some brown spots in this area. And so that's why I use a certain skincare routine. In the morning, I use a foaming cleanser, and that's great for oily skin because it will help sort of dry out some of the excess oil, but within reason. And then I put on a vitamin C serum. That's my tried and true antioxidant all the way every day. I put it here, I put it here, I rub it on the back of my hands everywhere. Depending on the time of year, so particularly in the winter, I will use a lightening agent.
Mm.
So I used a Skin Better Science lightening agent this past winter, which I've posted on, and I just put it where some of the darkening is. And then I'll also use a benzoyl peroxide cream from Neutrogena where my acne tends to develop, and then I'll put on my sunscreen. So that's the morning. And it's not that complicated. I know it sounds like a lot, but it's not. It's just, like very strategic and quick.
Okay.
Yeah, and my sunscreen is a tinted moisturizer with a tinted SPF with iron oxides, and
Oh,
it's fully mineral.
which one do you
So
use?
titanium. Well, there's a whole gamut, but like today I used elastin hydrogen.
Okay,
Yeah, and it does give you like a little bit of a glow. So at
sure.
this time of night, it's time to like, wash the face.
Absolutely.
Yeah. And at night, I use a gentle cleanser. I'll just use something that I personally, I like foaming, like I said, foaming sort of lathering cleanser. So I'll use a gentle cleanser and then I wait for my skin to dry. And then I use a prescription retinoid from Skin Medicinals. And my retinoid is going to have hyaluronic acid, niacinamide, and azelaic acid. So that I use that combo, which is pretty potent. And if I need extra moisture, I'll put on a hyaluronic acid serum.
That's great. That's such
So
a good
that's
one.
it.
Funny, my skin is probably the complete opposite of yours. I almost never develop, like, except for sunspots. I don't get darkening because I'm very pale, and I have more dry skin. So I actually don't even wash my face in the morning to kind of preserve moisture. Maybe a little water, and that's it. And then I try to use some sort of a serum. I like to rotate, but yeah, vitamin C. Although I find that I have trouble tolerating the smell of vitamin C serums, which I also hear from my patients as well. They can be potent, especially some of the more popular ones. And then I also try to use a tinted moisturizer. I have a problem that, and we have this problem in dermatology, some of the products aren't made for all skin types, and most tinted sunscreens are too dark for my skin type. So I have to blend very well. I think I'm using a Tizo one right now. I've used the Elastin one, and I like that too. And
Yeah.
I had to not use those every day because I'm wearing a mask at work and it ends up in my mask, which is kind of a
Yes.
unique COVID problem, but hopefully that will, at some point, we won't be wearing masks. And then in the evening, I like to use a moisture ceramides. I'm actually testing out something for a company, so I'm using that right now with ceramides. And then I like hyaluronic acid serum. I'm sorry, I start with my retinoid, I should say. Retinoid, and then the hyaluronic acid, and then a ceramide moisturizer. So, and my
Which
is
retinoid do you use?
I use tretinoin, just a prescription one.
0.05?
Yes, I was using, before I had my daughter, I was actually using tazarotene, which is like the strongest.
Oh
And my skin was rock solid. It did not even peel. It's amazing. So
wow.
a lot of people have a lot of peeling with retinoids, but I stepped up gradually. So that's something you can talk to your dermatologist about. But I started with like a baby over-the-counter retinol, and then I used 0.05, 0.025, 0.05, and then I actually went right to the tazarotene, and it worked really well. But I'm working my way back to that. So hopefully at some point I'll get back.
Wow.
Yeah, it's expensive.
Impressive.
Yeah, these are dermatologists. We compare our retinoid strength. This is how we
Yeah.
chat with each other at a cocktail party, I think.
Right. Oh my
Well,
goodness.
that was
That was
fantastic.
fun.
Dr. Weinstein, thank you so much. Sorry, I think you just cut out a little, help and interrupt you. Thank you everyone for joining. This will be up on the ASDS page. I know that I will try to make some Instagram posts from some of the questions we got here. Dr. Weinstein is a fantastic Instagram. Hers is obviously linked below. I'm at Hayley Goldbach, MD, and I would love if anyone wanted to follow us and get more tips. And always feel free to leave us questions on our Instagram posts. And we appreciate the ASDS for hosting this series. So thank you so much.
Yes. Thank you, everyone. Thanks, Hayley. Thank you for having me. It's
Thanks so
been
much.
really
Take care.
fun.
Bye.
All right. Bye.